Hi everybody, Dr. Brandy here, and I am going to be going over in this video everything cranial health regarding why it's important and how to help your child have the best cranial health in those first few years of life. So where we're going to start first is some basic anatomy so that we can see how all these parts play together. When baby is born, they have their skull bones not completely fused, and they also have these fontanelles on their different parts of their skull. So the one on top is the one we're most commonly associated with, and it's the big one that kind of sometimes you can see like a little pulsing happening on the top of the skull. I know it looks weird, but it's totally normal. And then also we have two on the sides of the skull, both sides, and then one here in the back. And the ones on the side and the one in the back, they tend to close pretty fairly on in the first year of life. The one on top closes a little bit later, between 13 to 24 months. It's a huge gap, but the reason why we pay so close attention to these fontanelles is to make sure, one, that your baby is born with them, and two, that they are closing at appropriate rates and not too quick or too fast. So you're probably wondering, why in the world would my baby's skull not be completely fused at birth? Well, there are several reasons for this. One reason is that the skull must be able to compress whenever it's coming down the birth canal and through the mother's pelvis. So that way, sometimes you'll see babies will have like a little bit of a cone head, which is totally normal. And this just shows that those sutures are working to be able to compress the skull and fit through the mother's birth canal and pelvis as it should. And the second reasoning is because we have a cerebral spinal fluid in our spine, and this fluid works very closely with your breath and a pumping mechanism between your skull and the very bottom of your spine at your sacrum. And so as the baby descends down the birth canal and the skull is compressed, and the first breath of life happens, this starts that CSF pumping mechanism. So that way that fluid can go up and down the spine and supply nutrients to all of the tissues and the nerves surrounding the spinal cord. And for the third reason, the brain volume of your child is going to be at 80 to 90% of its adult size by the time they are 2 years old. So we're talking massive brain development and growth in those first 2 years of life. Therefore, the skull has to be able to accommodate for that brain growth as well. The next part of the anatomy that I want to bring awareness to is going to be the dura system. And dura is a connective tissue fascia that covers your entire cranium and goes all the way down your spinal cord, covers your nerves, and attaches at your sacrum, which is at the bottom of your spine. And this is super important because it contains meninges from the brain and the nervous system. So oftentimes that we see through birth trauma and just the birth process in general, we see a lot of pulling and strain, specifically on the cranium and the neck, which results in pulling and strain and restriction in that dura meningeal system. And so what that can kind of result in is lots of issues within the first few months. However, when we're talking about being able for the brain to be able to communicate correctly through the nervous system, specifically with that proprioception feedback loop, letting the brain know where those muscles are, which is super important for milestone development and gross motor coordination, like we discussed in our last video. So getting your baby into a chiropractor right after birth to just check and make sure that system is completely restriction free is going to benefit your baby so much in the first year of life. They actually done a study on 100 babies, and they found that 99% of these babies had cranial strains that were happening in the skull after birth, as well as cervical restrictions, lumbar restrictions, and sacral restrictions. So like I said, super important after the birth process to bring your baby in. Let's evaluate it and get it resolved before it becomes an issue. So we have already discussed basic anatomy of the infant cranium, the importance of the dura-meningeal system, and why it's important to get your baby in to get checked after the birth process. The next thing that we kind of want to talk about is one of the common reasons why we see babies coming into the office is going to be flattening of the skull, phagocephaly, things like that. And while these may not be aesthetically pleasing, they may not seem like a big deal at first, maybe you just don't want your baby to have a flat skull, we must put emphasis on the impact that a flattening area of the skull will have on your baby's brain development. We've already discussed that so much development is happening in these first few years of life. So, and any areas of the skull that may be compromising to the brain and that meningeal system is going to have huge impacts, whether it's in the first year of life or later on in life. And so really putting an emphasis on making sure that your baby has good range of motion in their neck. They're able to use both sides equally and adequately. They're not always on their back, and they're making proper use of tummy time to really help strengthen those neck muscles and work through some of that trauma that has resulted from birth and the birth process. So I hope this video has helped with explaining a little bit about cranial health, why it's important. And if you're experiencing any kind of symptoms such as trouble with breastfeeding, pain while breastfeeding, your baby is not able to turn their head from side to side as well, or they're favoring one side versus the other, or they have any flattening of the skull, please reach out, find a provider to go to, get your baby evaluated. This is obviously very important. And if you have any questions, please, you can always reach out to me through any of the avenues. We have Instagram messaging at the Wellness Hive Chiro. You can email me at thewellnesshivechiropractic@gmail.com, as well as comment below, and I can reach out to you with any questions. As always, thank you for being here, and good day.